Welcome, and we are going to be covering Chapter 11 in this short video. And in this video, we're going to specifically look at special populations. For the most part, we've been talking about how to work with the regular population as it relates to exercise. But in this chapter, we're going to look at specific groups of people who have special needs that we need to be aware of as we work with them. The first special population group we're going to look at would be the elderly. And actually, the textbook divides elderly into three different divisions. You have what's called the young old, 65 to 74 years of age. Then the old, ages 75 to 84. And then old, 85 and older. And obviously, the young old would have a better physical capacity for various types of physical activity than the older counterparts. But the importance here is regardless of your age, we know that exercise is very, very important. And so even as one gets older, they should begin or continue being involved in exercise programs. The advantages for exercise for the older population, many of these are the same as it would be for someone who's younger, but they're going to improve their physical and mental well-being, improve their cognitive functioning. They're just going to have more energy and their quality of life will be enhanced. Exercise has been shown to slow down the aging process, and there's less chance of dementia and other related memory problems as one exercises on a regular basis. Because the older population is considered a special needs population, ACSM actually has testing and prescription guidelines that would be helpful if you're working with the elderly population. As well, they've found that peer mentoring seems to be very helpful as you work with the older population. They've done research where they have seen that a peer who basically is prepared and can provide the service that would be similar in characteristics is a more beneficial path to take than, say, some young professional who's trying to help someone who's an older exerciser. So that's important to know as you work with the older population. Needs group would be those that are recovering from injuries. And again, this could be injuries as relates to exercise or injuries as relates to athletics. I know several in the class are coaches or want to be coaches. So the chances of you working with the injury rehab group would be higher. Again, you just want to make sure you understand the person you're working with, their mental and their physical state, to understand any psychological barriers they might have that might inhibit a successful rehab process, and then to provide rehab services, actually training them and teaching them exercises that will help them back to a full recovery. And ultimately, you want to meet the needs of the patient so that they will get back to their pre-injury level of performance. Those of you that work in the health field will no likely come across cardiac and pulmonary patients that you'll have the opportunity to work with. Again, with these individuals, we need to provide a multidimensional intervention program that would involve counseling, educating, support, so that we can help those patients make the necessary lifestyle changes they need to make. We want them to replace the unhealthy habits with more desirable, healthy routines. And this is very important for the cardiac pulmonary group. Special populations, Chapter 11 mentioned, would include women who are pregnant, and we know that exercise is very helpful, very beneficial to these individuals. It's important to get doctor clearance, especially if They have not exercised much before, but exercise is a very positive activity to be involved in during pregnancy. And then also people with diabetes, people who are disabled, that would be physical, mental, emotional disabilities, how to work with them. We know that cancer patients, the use of exercise as it relates to treating patients that have cancer has had a lot of successful outcomes. And then there's a whole list of what we call chronic conditions, which would be more long term conditions that the individual has to deal with throughout their life. So these would all be considered special populations that you might have the opportunity to work with. You can see there are several different types of chronic conditions listed here. Not going to go through them all, but more than likely, as you are out into the exercise health world, you're going to be coming across individuals that will have these type of long-term chronic issues that you'll have to work with in order to help them find a safe, effective way to exercise. Finish up this chapter. There's a section about cultural differences, and usually we don't think of cultural differences as a special area to consider as it relates to exercise, but really, really very much is. First of all, it's important to understand why some cultures would put a bigger emphasis on physical activity than others, and then specifically what type of physical activities would they prefer. And then consider the type of programs you might want to offer, and then also how you might want to instruct and motivate based on one's culture. So don't overlook cultural differences as you work with people that come from different backgrounds, different upbringings.